Previously on Heart and Minds Aloud. If you were trying to express a person's experience, a person who was going through depression, how would you explain their experience?
I would say how would I say?
And then another one of the big words that we use when we talk about emotion, often depression.
Depression is waboto. That's how most people say it in Tree.
Yes. So, Auntie Eunice,
if academic concepts get captured in local language, then the local language will grow. But until you take it into that realm of academia, then the language remains just a means of everyday communication.
Hi, beautiful listeners. Welcome back to today's episode. And with that welcome, we're heading straight to the Volta region. Vamijo. Kwame, where are you from?
I'm from Abo Volta region.
In what country?
Ghana.
Kwame, you have this very interesting list in front of you. So if you had to find equivalents for these words in Ewe, would you be able to?
Yes, of course. I will be able to get some, but not all of them.
Let's give it a try.
Emotion. I really know what emotion is, but I'm sorry I can't get the meaning in my language.
Okay.
I would say sese.
Okay.
Sese.
Sese.
But I'm not really sure.
Okay.
But I think it's closer to it. So
Okay.
I will maintain that one.
Okay.
And we have fear. Fear is vovon.
Okay.
We have happiness, jijo. I'm skipping some words because I know I'll suffer a lot before I'll get it.
Of course.
So we have depression. I'm sorry, I can't get that one.
That's okay.
But depression, I can get it in another language, also in French.
Okay.
It's the same orthograph, depression.
Okay.
I have also here suicide. Suicide in French is suicide. And in Ewe, I don't know it. Self-love is amadokulolo. That is if I want to translate it literally.
Yes.
But
Exactly.
I'm sure we can have a word, a particular word for that particular one too. Yeah, just that I don't know it.
You don't know it. Okay.
We have self-care, which is amadokuijipokpo. So amadoku is like self, and then jipokpo is like pokpo is like look after.
Okay.
So self-care. So amadokuijipokpo, and po means see.
To look, I think.
To look,
Yeah.
yes.
See, my Ewe isn't that bad after all.
Yeah, so self-esteem. I'm sorry, I wouldn't get it in
That one would be hard. Even
Yes.
if you had to explain it literally like you did for the other
Yeah,
two.
no, I'm not gonna get it.
But quick one, Kwame. So if you had a difficulty that was mental health related,
Yes.
would you be able to express that to another Ewe speaker using Ewe?
Yes, please, I can
And the person will be able to understand you,
understand perfectly.
and they would be able to get you help.
Yes.
Thank you so much for your time, Kwame. It's been a pleasure talking to you.
Yeah, thank you too. It's a pleasure to me too.
Nora, I've been privileged to do some work with you and also being a practitioner who has Ewe as their mother tongue. What would you say about the translations that we had one of our participants give? How accurate would you say the translations that he gave were?
Yes, I would say I identify with some of the translations every participant gave. You know, in Ewe, normally we don't have one word for a concept like depression or self-esteem. So we only explain how we feel. So for depression, the person can tell you, I'm sad, that is ejimenye jomu, or I'm worried, or can tell you symptoms like I can't sleep, those are, we just give you the symptoms, but we don't have one word to explain depression in Ewe. So with emotions, with that one, we link emotions with feelings. So our participants mentioned that emotions is sese. So we link it together to say seselelame. That's emotions, how you are feeling. So that's it in Ewe. We don't really have one word for most of the concepts we use in psychology or in mental health.
And then of greater importance to me is this. Do you think it would be useful if our language started evolving to the point where it captured all of these emotions that we're talking about and explaining in words, specific words, so that it was very direct? And I ask this because if I'm explaining how I feel, I may use words that someone else may not necessarily use. So, some of the things that may be lost in translation. So I can just, as a practitioner, you are just sort of estimating what's happening to me based on what I'm describing, but maybe if there was a specific word, it will be spot on and there will be no ambiguity for the patient and also for you, the practitioner, so that you're in a good enough place to help them. So do you think it will be useful to have our language evolve to the point where we have specific words for specific feelings in our local language?
I think it would be useful, but the problem is, are we now going to teach this new concepts to the natives? How do we get it across? How do we let them know that this is it? This is how this concept can be explained, or this is a label for this particular feeling you're having. That would mean that we need to teach it to the native speakers. So that would be the only challenge there. But I think that what we are doing already is not too bad. Just explaining the concepts to the person. Let the person to explain back to you what they feel. I think that in itself is not bad. Because if we want to reteach these concepts to the people, I don't know how we go about it as clinicians, and a person come to you. I don't know how we are going to train the people, or how we're going to put this across for them to know that, okay, this symptoms is called depression, and then this is the meaning of depression in the local language. I don't know how we will get that across.
Guys, we're heading to the north. This should be interesting. So, Francis, can you tell me how often you get to interact with people about mental health in whatever context? And by people, I mean people in Ghana.
On community basis, I don't really interact with people with mental health issues or about mental health in general. But at workplaces, the interaction goes on and it's very often.
Okay, so where are you referring to when you mention workplaces?
At the hospital, in the psychiatric unit and the psychology unit.
Right. So that gives you ample opportunity to discuss mental health. Now, here's my area of curiosity, should I say. When you are communicating with your patients, in what language do you make yourself understood to them? And when they're trying to make themselves understood, what language do you find that your patients often use?
With the language that I communicate through to the client, it depends on the language that the client is comfortable or familiar with. And my setting being the northern part, that's in the Upper East region, where Frafra is a dominant language. Most of the clients will prefer speaking in their native language, that's the Frafra. However, some will also express themselves in English and in Twi if they can. But mostly the languages are being mixed up. So the person may start speaking Frafra, but certain terms will be said in English, and others to start maybe Twi and mix it up with English. And some will also try to, in attempt of speaking English, they will use the local language to best explain how they are feeling, and also go in the same line for easy understanding of the whole situation at hand.
Okay, it sounds like you have a hang of this. In that case, I'm going to ask you a few questions. So these are words that I think will come up in your work with patients, or at least in talking to your colleagues or other people about mental health. They might come up. So we'll just see how well or what kind of mastery we have over our local languages when it comes to mental health. So let me know which of these words you can find direct translations for in your language, which is Frafra. I would start with a major concept in mental health, which is empathy. How would you say empathy in your language?
With empathy, there wouldn't be, or let me say, there hadn't been any single word that I've come across. However, the clients or myself will try to put it in a form of using like understanding the person's feeling. So in the language, you will say, oboke, ma. Light must say, meaning you understand how it's doing me. That's literally translating it. You understand how it's doing me. So, bokeh, light must say. I hope it will be clear enough for you to understand. But that's it. There wouldn't be any single word, but it will be said in the statement, as I've said earlier on. And that statement translates to understanding from the person's point.
I'm excited. I feel like I'm getting a lesson in Frafra for free. I think because you have the advantage of being a professional, you're able to approximate the meaning of the word. Would that be right? So that even if there isn't a single word for it, you can like you're saying, you can find different words that convey a similar meaning. That's really good. Let's try two more words. One of them would be trust, and another word would be fear.
With trust, in Frafra it is sra sacre, and literally translating as truth acceptance. But it's made from the two words truth and acceptance, truth acceptance. But the one word for trust is sra sacre, and fear is dabe, fear dabe, and that one is just a single word. It's not derived from any combination of words. So that's it.
So it's like you accept that what I'm telling you is true, so you trust me. Would that be the concept behind the explanation for the word for trust? I'm just being curious, but I think it's so interesting. Sra sacre.
Yeah, sure. I don't know how our forefathers coined those words, but I think it was based on that concept that acceptance of the truth or accepting the truth was used to replace or to mean trust.
Okay. Francis, here are three more words for you: attachment, vulnerability, and more common one, happiness. What words would you find for these?
And with happiness, it's pupillum. Pupillum, that's a word being used for happiness. To be vulnerable, I can't even get combined words, neither would I even get a single word. And attachment is malum. Malum. And that malum actually means to become so used to or fond of. So in a statement like they say, I'm malome or malohome, that means I'm attached to you or so used to you. So malum for attachment, pupillum for happiness, vulnerability I can get anywhere. I don't know how it even be expressed.
Thank you very much, Francis. I'm curious. First of all, for attachment, you know the translation that you give for attachment, would that carry the same meaning as it does in English, even though the translation that you gave approximates a meaning in Frafra? Would it carry the same sense as it does in English so that you could convey that same meaning to a client or a patient who was in front of you? For example, if you're talking about attachment styles.
I don't think the Frafra word and the English version, I don't think it will always carry the same meaning. Maybe with the extent at which a person is expressing it might not be well felt.
And again, for vulnerability, what do you make of the fact that we can't find a word for it? Is it that vulnerability doesn't exist in the local context or among Frafra speakers, or something that nobody pays attention to? What would you say?
For vulnerability, that concept is there. The concept of vulnerability is there, but vulnerability tends to be like it's a kind of a weakness thing. And in Ghana, or let me say our part, strength is something which is upheld over weakness. So even if someone is vulnerable to something, they wouldn't even try to portray it in that sense that they are vulnerable. It might be said in a different way of which I wouldn't know. So I think maybe because it's something which is not upheld, being vulnerable or it depicting a picture of weakness, that's why maybe it's not commonly used. It might be that I'm the one who's not getting the right word. It might exist, but I don't know about it. And the attachment. Well, I think that's all that I can say. The attachment, as I've said, it won't carry the same meaning. To a specialist, you might understand it very well because you understand the concept of attachment. And from the layman's point of view, you can relate that no, this attachment that the person is explaining. But if you are a professional, you are trying to state that word, say it as in you are fond of or you are so used to something to the client, they might understand it in a different way. Hence, the meaning will be lost by the time the communication ends.
So, to push it a little further, a word like emotional dependency or something like emotional constancy, actually, those are two words, not single words, but would you be able to explain them? These, I wouldn't even ask if you can find single words for them. The fairly common ones like depression and anxiety, or even suicide. How do you express these, or how do you have people express them to you?
With words like emotional dependency, I wouldn't be able to explain or find a simple word for it. Depression in Frafra is mostly expressed, like let me say the dominant words that will be used is dango, which means worry, and pupelum kabui, that's happiness doesn't exist. However, these are somehow like symptoms that people express. Suicide and anxiety mostly are also expressed using individual symptoms, which are stated in a form of descriptions rather than a single word. So when this happens, it's up to the clinician who understands the concept in English and the local language which the client is explaining or describing to relate that, okay, this description is actually this word in English. Other than that, there wouldn't be any single word or for suicide, anxiety, emotional dependence, and others.
And finally, what do you think we can do better as clinicians and then as everyday people to be able to improve the dialogue about mental health in our local languages, so that it's not just the person who can speak and understand the English language who is able to express their mental or emotional health?
To improve upon the dialogue about mental health in our local language, I think mental health workers or personnel, they should be trained on how to adopt the translation method. And if I say the translation method or approach, this is where maybe a workshop can be organized for the healthcare workers or the mental health workers at the facility level, where words which are frequently used or mental health words which are frequently expressed will be translated from the English to the local language, frequently used concepts or words. And when it's done at workshops, the mental health workers or personnel will be able to understand these words. Then they also use it at the community level so that the town folks or the indigenous can relate. The indigenous can relate the words to their emotions and to their thoughts. I suggest this to be done at the facility or the community level, because if it's to be done at the classroom level, mostly those who come to the classroom to study about psychology, psychiatry, mental health, or whatever related, they come from diverse backgrounds, diverse ethnic backgrounds. And if you are going to use a particular language to teach, it will be very difficult. A particular local language, it will be very difficult. And you can't teach them all the languages.
Welcome, Salim. Thank you very much for joining me. Thank you very much for making time for the interview. I really appreciate it. I think that this is an important topic, and I'm grateful that you joined me to discuss it. For our beautiful listeners, I'll first ask you what local language you are very comfortable speaking. And just to clarify, is this your mother tongue? Would you call this your first language?
Thank you very much for giving me the opportunity, and I'm always ready to share my knowledge. I'm more comfortable with Hausa. Hausa is my mother tongue, in and out, both father and mother.
Okay, Salim, if you were asked to give a client or a patient therapy in Hausa, which in your first language, what would first come to you? Would you panic? Would you second guess yourself? Would you take some time to think about it? Or would it come naturally to you, like, you would respond if you knew that you were going to give a client therapy in English? Would you feel like giving your client therapy in your first language would be a challenge?
Therapy in its technical meaning, I would have to second guess and look for the right words to translate some of the procedures. But maybe in building the therapeutic relationship, that is easier, because once you speak the local dialect, the person feels more relaxed. But to do CBT and begin to think about all the terms, explaining empathy, as well as self-care and venting, that I will have to second guess and think about the words.
I ask this because most of us have become so comfortable with English that sometimes even for certain words, we have to think about them for a while to find them in our local language. And we find that sometimes when we're speaking our mother tongue, we substitute words with English words because they come easily to us. So what would you say? Would it be challenging for you to give therapy in Hausa?
Yes, Baba, like I said in earlier audios, there is a bit of challenge which requires some level of concentration and fishing into your local dialects to find words, because your training is extensively in English. Practice is in English till you meet clients who can't speak English. Then you have to bring your sleeves on and get it translated.
Have you had any clients come to you at all who had no choice, who spoke no other language than Hausa? And what did you do about this?
I have had a number of them, not one, not twice. a number of them on the ward, in the therapy room, all of it. And for me, it was always a challenge. It gave me insight to things I needed to learn and how I needed to be more flexible if I wanted to be impactful in this area of profession. And there was a need for me to break down and be able to reach the people at their levels, because not everyone has the benefit of formal education. So you find people who are very smart and intelligent, but they have some emotional or behavioral difficulties, and what they want to discuss it in and find solution is in Hausa. So every time I had met that was a challenge, but I think I could say I did my best to always rise to the occasion.
Would you say that people from the areas where your mother tongue is spoken, would you say that they don't really recognize psychological services as an essential service? Or is it that probably they do recognize it, but because they don't have access to it, they don't, kind of go out of their way to look for it?
There are a number of factors that play a role here in terms of its recognition. First of all, most people do know they have some mental health difficulties in terms of how they are managing their behaviors, how they are reacting to things, their memory issues, substance use. In my area, I see a lot of it, and people do accept. Now, in seeking the help, sometimes it's costs and finances, and other times they do not see it like something they can relate with, because most of the time these things are presented in the formal language. The person is a bit distant to it, and it raises the questions of what we have done as professionals to reach these people and to explain these things in very local way so that they can relate to it. Because when a person sees the importance of their mental well-being, then the issue of monetary, though might be a problem, would not stop them from coming.
Now, here's a little test. So I'm going to give you a list of words and ask you to translate the ones that you can very easily. You don't have to know all of them. Just the ones that maybe you've heard being used or some way, somehow you know in your local language. Now, we've done this with one or two other local languages. I mean, we're not comparing, but we're just teaching ourselves how accessible or available these words are and how well people even know them. So let's go. Maybe I should time you or something.
This is gonna be an interesting test. Let's see how I do. Now, to translate some of the words provided in Hausa, I would say for most of the time, emotions are depicted by two things, the brain and the heart in Hausa, which is the brain is hankali and the heart is zuciya. So emotional dependence will be dogaro kan wani ka samu kwanciyar hankali, and emotional constancy would be the kwanciyar hankali. Vulnerability is rashin kamala ko abin da ke sa ka samu wani curuta. Happiness would be jin daɗi. Attachment is the dogaro. Depression is bakin ciki. Anxiety is tsoro or fargaba. Mental health will be lafiyan hankali, and mental illness will be ciwon hankali. Emotional health will be lafiyan zuciya. Contentment will be wadata. Suicide will be kashin kai. Self-love will be son kai. Self-care will be taimako ko duban kai. And self-esteem will be kabuli. I think this explains some of the words there.
Salim, you didn't do badly at all. This is very useful, very detailed. Again, thank you so much for your time and for the valuable knowledge you shared with us. Hopefully you can join us again on this show another time.
Thank you, Baba, for your time, and I appreciate the opportunity. Like I said in Hausa, Allah ya kai mu sabon mako, kuma Allah samu dace.
This episode has scratched the surface of something very important, if you ask me. We have so much going for us in terms of language, and I think that we should look for creative ways to make it work for us even better. Everybody deserves access to mental health care, and it will be most unfortunate for language to be the barrier that keeps them from accessing this. What language do you speak, and how easily do other speakers of your language access psychological services or emotional and mental health care? Think about it. Inyoride Baba Dadzi. Ochine radio adafetra heart and minds aloud ne. Eba nagbe. Se wunyanye ya. Eni etu anamo na susu yen modern bo wo YouTube so. Tim so. Na chenama afofro asunti jumedie yi. Mile Instagram G, Bakple Facebook G. Miebon konye Hearts and Minds Aloud. Nago de Saboda Sauraro. Shemako Mezua.